Welcome. My name is Bria Gerald, and I am a public health analyst.
My name is Lauren Powell. I'm also a public health analyst.
And we will talk to you today about preventing high impact data quality errors. So, our learning objectives for today are understanding NHSN Data Quality Check categories and procedures, identifying common data quality concerns in NHSN data, understanding the impact of common data quality errors on CMS performance, and utilizing tools to evaluate data quality independently.
So first, I'll be going over our quarterly data quality checks process. To assist with ensuring high quality data, the NHSN dialysis team completes regular data quality checks. So we complete these checks every 3 months to identify potential reporting errors in the data reported by facilities in the NHSN application, such as data that violates our business rules, reporting guidelines that are set by the dialysis event protocol, any incomplete or missing data which might result in them having a score reduction for CMS QUIP, or any inconsistent or improbable values on either the numerator or the denominator records. On the next slide, I'll start with talking about the data that we collect and the checks that we do on them. So to start out with, we have our event data, and this data refers to anything that's entered using the dialysis event form. So those are events that happen with the dialysis patients, and the checks that we do on them are limited to only the numerator forms or the event forms for ESRD patients. Outreach is conducted if we identify any errors, so we'll reach out to the facilities and let them know the error that we saw in their reporting, and try to resolve it with them. Next is the CCN. So CMS uses CCNs, which are CMS certification numbers, to identify unique dialysis facilities and request NHSN data from those facilities. And this is for the ESRD QUIP program. Each facility should have their own CCN. So they should have an org ID and a CCN. So we monitor to see if there's anything mismatching or anything unexpected there. And then we also look at denominator data. And this data is collected using a different form, which is the monthly reporting plan and summary data forms. And so this is separate from the event data, which is submitted every month that we talked about at the top of the slide. This is what creates a denominator of the data, and it tells us the number of patients that are in the population. So we can use this to calculate BSI rates and things like that. So this form captures whether or not a facility is participating in surveillance. So even if they have no events, we still expect them to submit denominator data. It tells us the number of patients at risk and whether certain reporting criteria are met. And on the next slide, I'll kind of dive a little deeper into the data checks that we do, and I'll talk about some of the numbers that we saw in 2024. So this is our numerator data, it's the event data, and you have the definitions on the left-hand side. So we have 4 different alerts that can happen during the checks. The first one is 21-day rule violations. There's other access, blood culture wound check, and days between ABX start. So those are all different alerts that they can get, and you can kind of look at the definitions there. But on the right-hand side, you can see how many facilities had each of those alerts during each quarter in 2024. So you can see that overall, the number of alerts kind of went up until quarter 3, but then in quarter 4, it was pretty low. So there's some seasonality there, but overall, the rate of facilities having a alert for numerators was very low. On the next slide, This is the CCN data. Similar to the event data, there's also 4 different alerts that they can have. So the first one is 2 org IDs with 1 CCN. This is kind of what I was talking about before, where we're looking for anything that's unexpected. So this is when 2 facilities have the same CCN, which isn't what we would expect. And then it would be hard for us to decide which facility would get the numerator or denominator data applied to it, for example. Incorrect CCN. So this is when the CCN is in a weird format, no CCN entered, and then multiple ESRD locations. On the right-hand side, you can see how often each of those errors happened in 2024. On the far right side, you can see the total column, and you see that for CCN errors, we've had like a pretty steady decrease every quarter, which is exciting. In quarter 1, we had 86 total facilities have at least one error, and then by quarter 4, we had 64%. And on the next slide is the same view, but for denominator data. So the 4 alerts you can have for denominator data is no DE plan, missing RNE box, not participating in all 0 denominator. For the first one, this summary data kind of creates the denominator for our numerator data, which is event data. So even if a facility doesn't have any events, we still expect them to report all of their data, even if the numerator is a 0, and we expect them to report all of their denominator data. And so if they did not submit a DE, if they did not check their DE checkbox, that's why they'll get that alert. And then you can also see the other alerts below there too. On the right-hand side, you can see a little bit of up and down also. So you started out around 2,000 facilities having an alert, and then it goes way down to 738, and then it increases again and decreases again. So this is kind of going up and down, and we're hoping for it to be a little bit more consistent this year. On the next slide, just an overall summary. We saw an overall increase in organizations with error alerts, but as I just discussed on the previous slide, that's mostly driven by the denominator data issues versus the year before in 2023. And a facility getting an alert isn't necessarily the worst thing. It means that we can reach out to them and we're ensuring that our data quality is great. Numerator data and CCN data stayed relatively similar, a modest increase for numerator and a modest decrease for denominator, for CCN, and then denominator had a significant increase. So that's something that we're hoping to get down this year. And I'll pass it back over to Bria for the next section.
Next, we're going to talk about addressing high impact data errors. So all of the data that you enter into the dialysis module on NHSN is high impact data. So 12 consecutive months of data reported to NHSN are required for successful participation in the ESRD QUIP measure. To have complete data, a facility must, for every month, so all 12 months, select a location and the DE box on the monthly reporting plan, complete summary data form, and report at least one event of each of the 3 dialysis event types. So that's an antimicrobial start, a positive blood culture, or pus redness and increased swelling, or must select the appropriate report no events box on their summary form if the facility did not have any events to report for that specific month. So it is imperative that you complete all of these 3 for all 12 months of the year to receive all credit under the ESRD QUIP measure. When doing this, in order to receive credit for the ESRD QUIP measure, you must complete all 3 of those steps successfully for all 12 months within each ESRD QUIP deadline. So in front of you is a table that contains all the deadlines for 2025 for all 4 quarters. So you have for Q1, the deadline is passed. That was June 30th, 2025. For Q2, which is April through June, the next deadline will be September 30th, 2025. For quarter 3, July through September 2025, that is due December 31st, 2025. And for October through December 2025, which is Q4, that is due March 31st, 2026. So, in order for any of the data that you submit to count, it must be submitted not only correctly, but it must be submitted on time. Any data submitted after the ESRD QIP deadlines will not be included in our report to CMS for the ESRD QIP measure. So let's talk about data quality essentials. First is the data quality checks. You've already learned a bit about this from Lauren earlier in the presentation. So again, those data quality emails are sent for 4 individual categories. They're sent for CCN, numerator, denominator, and AKI. However, AKI does not impact the ESRD QIP measure. So even though we send emails for it, only CCN, numerator, and denominator that you heard about earlier impact the ESRD QIP measure. Emails include a description of when data was captured, the upcoming quarterly CMS deadline, and a PDF attachment. So you can see on the left side of the bottom of the screen, that is an example of what an email would look like for a data quality check. The PDFs attached to these emails identify the specific data quality errors, facility information, and instructions on how to fix the data quality errors identified. It is important to read it in full because there is a lot of important information in there. And if you are a facility administrator with multiple facilities that you are over, for example, someone who may be associated with a large dialysis association or organization, it is imperative that you read the entirety of the PDF to ensure all data quality errors are properly addressed. If a facility is identified as having a data quality error, the facility administrator will be alerted. It is essential that the facility administrator contact information is up to date in NHSN. So that will be on your facility information page. If out of date, updates and reassignments can be made in NHSN by the original facility administrator. So for facility administrator reassignment, if the current facility administrator is not available to make the reassignment in the facility, an FA reassignment form will need to be submitted to NHSN. When received, the user support team will process the FA reassignment form on behalf of the submitter within 5 business days. And if you need the link for that, that is included here within the slide. If you need to reassign a facility administrator for more than 20 facilities, please submit a request to NHSN via email or ServiceNow, and specifically to Rebecca Jones. Please provide the following information on the spreadsheet: facility names, org IDs or CCNs, and addresses if possible, and name and email of the new facility administrators. But please do not fill out over 20 facility administrator reassignment forms for this specific issue. So we're going to now talk about some of the most common data quality errors that we see that have significant impact on the CMS ESRD QIP measure. So Lauren touched on some of these before, but I'm going to get a little bit more in detail about how you can identify this error yourself and correct it. So the first one, the main one that we see during our processing of the CMS files is the missing R&E checkbox. So this is on your summary form. So how to prevent this is to select the appropriate report no events box on the summary form if an event of the specific type did not occur in the reporting month. Ensure event data is entered and corrected in a timely manner to avoid potential missed errors. So if you make any adjustments or edits to event data after you've already done your summary form, so for example, if you had a summary form for April and you had your events already entered for April, but then you changed one of those events, it's imperative that you go back and make sure that your report no events box are properly checked, because that is the biggest error that we see that results in facilities not meeting a full 12 months of reporting. Next is a missing monthly reporting plan. So how to prevent it is to select the location and the DE box on the monthly reporting plan for each individual month of the reporting year. Either box being left blank will result in a loss of credit for the month. This could be done in advance for all months of the year after completion of the current year's annual survey. Essentially, what that means is after you complete the annual survey as required, you are able to, in NHSN, make monthly reporting plans and do all of your monthly reporting plans for up to a year in advance. This will save you a lot of time and this will save you from making any potential monthly reporting plan errors. And finally, we have all CCN errors. So, how to prevent it is to ensure on the facility information page, the same page where also your FA information is to make sure that your 6-digit CCN is properly the one that was provided to you by CMS. Make sure it's entered correctly with no spaces, no dashes, and no letters, unless informed by CMS. Incorrect CCN can result in reported data not being sent to CMS. So whenever we go about processing the annual CMS files, we attach your org ID data to your CCN data. If your CCN data is not correct, we cannot send your information to CMS. We can only send information to CMS for the CCN list that they provide us. So please make sure on a regular basis that you have the proper CMS certification number entered on NHSN. So, data quality essentials. Remember that data quality checks are captured 8 weeks before the CMS deadline. This is done so that we are able to give you adequate time to not only address errors, but also ask any questions that you may have when it comes to those data quality errors. So since this data is captured 8 weeks before the CMS deadline, it's only a limited amount of data included in these checks. It is essential for facilities to conduct their own personal data quality checks in addition to the checks provided by CDC. So we have some recommendations. We recommend that on a monthly basis, you ensure all data has been reported and ensure the accuracy of that reported data. We suggest on a quarterly basis that you investigate potential data quality errors and that you ensure all months are within dialysis surveillance reporting protocol and ensure all summary data, which is denominator data, is in alignment with dialysis event data, which is numerator data, especially in the case of late added events and or edited events. So we're going to talk a little bit about how to actually go about self-reviewing, and we're going to talk about generating reports. So how to locate and generate reports in NHSN. To run analysis reports in NHSN, users must first generate analysis data sets. To do this, you can go to the Analysis tab and click Generate Data Sets. This will make sure that the reports you are running represent data accurately as they exist currently in NHSN. After generating data sets, users can generate reports by going to Analysis and then clicking Reports. So one great tool is line listings, and we have a variety of them. One is the CMS ESRD QUIP rule line listing. So this gives you a lot of pertinent information about your data. First, DE on reporting plan equals Y should be what it says. If DE is checked on the monthly reporting plan, indicating dialysis event data will be collected according to the dialysis event protocol, then it will show yes for DE on reporting plan. If for each dialysis event type, at least one dialysis event was reported that month, or the corresponding report no event checkbox was properly selected on the denominators for outpatient dialysis form to confirm there were 0 events of that type for the month, then you will see a Y for yes under the dialysis event numerator reported. And if the denominators for outpatient dialysis census form were completed for the month, you will see a Y for dialysis event denominator reported. So you want to be in a situation where for every month of the reporting year, you want to make sure that all of these tabs show a Y. And at the very end, as you can see, there's criteria met this month. So if any of the tabs are an N, then this will show up as an N. So you know that at least one of those tabs and one of those protocol have not been met for the month. So ensure that for all 12 months, the criteria met this month tab shows a Y for yes. We also have line listings for dialysis events and denominators. So for the dialysis event line listing, it checks all dialysis events are correctly reported and review the data validity check PBC and ABX description, so the positive blood culture and ABX start description column, and check if the antimicrobial starts or positive blood cultures were missed. For the line listing for all DE denominators, you're going to review denominator data across months for each vascular access type, verify minimum and maximum values are reasonable, and the numbers of patient months are consistent with the facility's census. This is very important because the patient months do go into calculating your actual SIR score, and sometimes typos can occur where there may be mistakes in those numbers that will cause you to have an inaccurate SIR. So you want to make sure that these numbers are properly reflective of your patient population. Data quality and validation. So the CDC has developed recommended approaches to investigate and enhance the accuracy and completeness of NHSN dialysis event data. Users should visit the NHSN Data Validation webpage for appropriate year's data validation guide and toolkit. This webpage was developed to assist nurses, infection preventionists, or quality professionals at outpatient dialysis facilities to report to NHSN, State Health Department, or end-stage renal disease network personnel who work with facilities to enhance NHSN data quality for surveillance, reimbursement, quality improvement, research, or public reporting purposes. The CDC has developed the external validation toolkit and appendices document, which include the template and forms necessary to implement a data quality evaluation project. And they can be found included in the link below. Thank you so much for being with us today and learning about high impact data quality errors. If you have any questions, feel free to always reach out to the CDC help desk. Thank you.